Hello everyone, I am Dr. Pradeep, consultant orthopedic surgeon and sports injury specialist at Devadas Hospital, Madurai. How do you manage pain during sports activities? So many of us will be having an interest to learn new sports or continue the sports which we have been doing for a long time, and majority of us could be weekend warriors, like we work for 5 to 6 days a week and then play on the weekends. So pain is an important factor which decides how to play, what to play and when to play. So pain, usually there will be a certain incident where you have to go through the pain. So that happens as you grow older and your joints become less supple and you start playing more intensely, thinking that an intense play will let you get through the pain. But it's not like that. So why does pain occur? Basically, the flexibility which you had in your teens when you were 15s or 20s will not be there when you are 30s. So the majority of pain develops because your joints are less supple and your muscles will not be able to take the workload. So how do you avoid pain? So the main factor is you start with a warm-up. Any sports for that matter, you play shuttle, badminton, tennis, cricket or whatever be the sport, have a proper warm-up. So initially the warm-up has to be 20 minutes. You do warm-up for 20 minutes and then start playing. If you have an 1 hour session of play, minimum warm-up of 20 to 30 minutes is needed so that your joints are moving accordingly. So if there is a good warm-up, your muscles start firing well, your joints start moving well, there is good lubrication and you can play at your best. So in unfortunate circumstances, even after warm-up, there can be pain. So the main factors contributing to the pain are some injuries. The most common injury in any sport is a sprain, and the most commonest involved joint is an ankle joint. So ankle sprain is the most commonly involved sprain in any sport, basketball for that matter, or shuttle, badminton or tennis, whatever be the sport. So ankle sprain, basically there is damage to the ligaments around your ankle when there is a twisting or rolling over movement of the ankle. You may be playing a drop shot, trying to take a shot, or jump landing in basketball, there can be an ankle sprain. So what do you do initially? So when there is a sprain, you immediately stop playing so that you don't aggravate the sprain. If it's a small grade 1 sprain, it will just get alright in a week or two. So what do? You stop playing, apply ice. Okay, do not massage the place, apply just ice on it. Take out all the bandages, shoes, socks and everything. Just apply ice for some time, elevate your legs and then better consult a doctor nearby so that you can know what type of pain it is, what type of injury it is and how do you get back to sports. Almost all persons who have a sprain will get back to sports in the near future, maybe 1 week or maybe 1 month, depends on the type of injury. So what do you do after a sprain occurs? You wait for some time till the swelling subsides. You either use a crab bandage or analgesics, let your joint heal and then start playing. That is the rehabilitatory phase. Once the pain settles, what you do is you start moving the ankle, start doing exercises more and then go back to sports. This is for ankle. So there are other injuries like this. For example, this is the knee joint. So this is a knee joint which has all the ligaments around it. So when there is a certain type of injury like jump landing in basketball, a ligament called an ACL, an anterior cruciate ligament which is inside the joint, can be torn. So this one needs more further evaluation. You may need an X-ray or an MRI scan to evaluate what type of injury it is. So this one may land up in surgery because an anterior cruciate ligament will not heal on its own. This will need an arthroscopic surgery. So each type of injury has a different management. So all you need to do is, if you are injured on the field, stop playing immediately so that you don't aggravate the injury. Go for a consult nearby to an orthopedician or a sports injury specialist and then you can go ahead and further plan your rehabilitation phase and then get back to sports at the earliest. Thank you.